As we grow older, many small changes happen in our body, quietly and slowly. We often notice pain in the knees, stiffness in the back, or low energy. But there are some changes we ignore for a long time. One of the most common areas we forget about is our mouth and throat. We eat every day, we talk every day, we breathe every day, yet we rarely stop and think about what is happening inside our mouth as we age. After the age of 50, the mouth becomes more sensitive. Gums are not as strong as they used to be. Teeth are not as protected as before. Saliva production can reduce, and when that happens, bacteria find an easier place to grow. This is why many people over 50 complain about bad breath, bleeding gums, sore throat that comes again and again, or a constant strange taste in the mouth. These problems may look small at first, but over time, they can affect comfort, confidence, and overall health. Many people believe these issues are just part of getting older, so they accept them quietly. They chew on one side, avoid cold or hot food, or keep lozenges in their pocket all the time. Some people start using strong mouthwashes that burn the mouth, thinking the stronger the burn, the better the cleaning. Others depend only on medicines and antibiotics whenever infection appears, even for minor problems. But the truth is, not every problem needs a heavy solution. Especially after 50, the body responds better to gentle, consistent care rather than harsh treatment. What we need is something simple, something easy to manage at home, and something that supports the natural balance inside the mouth instead of disturbing it. The mouth is home to many types of bacteria. Some are helpful and some are harmful. Problems start when harmful bacteria grow too much. This can lead to gum disease, bad breath, infections, and even throat discomfort. Keeping this balance under control is very important, especially as immunity becomes weaker with age. Now, before going any further, one thing must be clear. This is not about replacing your doctor, and it is not about ignoring medical advice. This is about adding a simple, safe habit to your routine that supports oral and throat health, something that has been used for many years and something that is easily available. There is a common item that many people already have at home, but they only think of it for cuts or wounds. They do not realize that when used correctly and safely, it can also support mouth and throat hygiene. This item is not expensive, it does not have a strong smell, and it does not require any special equipment. As we age, we must be more careful about what we put into our body. That includes what we put into our mouth. Many products today are filled with strong chemicals, artificial flavors, and harsh agents that may clean for a moment but irritate over time. Sensitive gums and thinner oral tissue after 50 do not tolerate these things well. That is why gentle solutions matter more now than ever before. Gentle does not mean weak. It means effective without causing harm. It means supporting healing instead of forcing it. Another important thing to understand is safety. Anything used in the mouth must be used in the correct way. More is not better. Stronger is not better. Correct is better, especially for older adults. Following the right method is just as important as the product itself. In the next part, we will talk clearly and slowly about how this simple solution can help with gum health, mouth freshness, and throat comfort. We will also talk about the correct way to prepare it, how long to use it, and what mistakes to avoid. Everything will be explained in plain language, step by step, so it feels easy and safe. If you have ever felt embarrassed by bad breath, if your gums bleed when you brush, if your throat feels irritated for no clear reason, or if you simply want to take better care of your mouth as you grow older, then this information is for you. Aging does not mean giving up comfort. It means choosing smarter care. And sometimes the simplest habits make the biggest difference over time. As we move forward, let us talk about the mouth, the gums, and the throat in a calm and practical way. After the age of 50, gum tissue becomes thinner and more delicate. It does not heal as fast as it once did. This is why even gentle brushing can sometimes cause bleeding, swelling, or discomfort. When gums are weak, bacteria get a better chance to settle in, and that is when problems slowly begin. Bad breath is one of the most common complaints at this stage of life. It is not always caused by poor hygiene. Many people brush twice a day and still struggle with it. The reason is often bacteria trapped deep in the gums or at the back of the tongue and throat. These bacteria release gases that create unpleasant odor, and normal brushing cannot always reach them. The throat also becomes more sensitive with age. Repeated throat irritation, mild pain, or the feeling of something stuck can happen even without a cold or flu. In many cases, this discomfort is linked to bacteria living in the mouth and throat area. When immunity is not as strong as before, these bacteria can cause trouble more easily. This is where a gentle disinfecting routine can help. Not something harsh, not something aggressive, but something that reduces harmful bacteria while respecting sensitive tissues. One such option is properly diluted hydrogen peroxide, used only in the correct way and only for a short time. It is very important to understand this clearly. Only the common 3% hydrogen peroxide should ever be used. This is the same concentration sold in regular pharmacies. It must always be diluted with water. Never use it directly, and never use a stronger concentration. Strong solutions can damage tissue and cause irritation, especially in older adults. The preparation is simple. Take 1 part of 3% hydrogen peroxide and mix it with 2 parts of clean water. You do not need a large amount. A small cup is enough. This mixture should look clear and light, not strong or sharp. Once prepared, take a small sip into your mouth. Slowly swish it around, allowing it to reach all areas, the gums, the sides of the mouth, and under the tongue. There is no need to rush. Gentle movement is enough. Do this for about 20 to 30 seconds. If throat discomfort is a concern, you may gently tilt your head back and gargle for a few seconds. There should be no force, just a calm, easy gargle. During this process, you may feel a slight bubbling sensation. This is normal and expected. It means the solution is working on bacteria. One rule must never be broken. Do not swallow the liquid. After the time is complete, spit it out completely. Rinse your mouth with plain water afterward. This step is important, especially for people with sensitive mouths. This routine should not be done many times a day. For most people over 50, once a day or even a few times a week is enough. Using it too often does not make it better. Balance matters more than frequency. Over time, many people notice that their gums feel calmer. Bleeding reduces. Breath feels fresher, not masked by strong flavor, but naturally clean. The throat may feel less irritated, especially in the morning or after speaking for long periods. It is also important to listen to your body. If there is any burning, pain, or discomfort, stop and review the dilution. Often, discomfort means the solution was too strong or used for too long. Gentle care always works better than force. This method is not meant to replace brushing or flossing. It works best as a supportive habit, alongside normal oral hygiene. Think of it as helping your mouth reset its balance, not overpowering it. In the next part, we will talk about teeth color changes with age, small mouth sores that can become painful, and how careful use of this same gentle solution can support healing when used correctly and sparingly. Taking care of your mouth after 50 is not about doing more. It is about doing things the right way, with patience, consistency, and respect for your body. As we continue, let us talk about teeth and those small problems inside the mouth that often become more uncomfortable with age. After 50, many people notice that their teeth no longer look the same. Even with regular brushing, teeth may appear darker or slightly yellow. This change is natural. Over time, the outer layer of the teeth wears down, and stains from tea, coffee, or food become more visible. At this stage of life, the goal should not be bright white teeth like in advertisements. The real goal is clean, healthy teeth that are free from harmful buildup. When bacteria are reduced and the mouth stays balanced, teeth often appear cleaner and brighter in a natural way. Proper oral hygiene supports this process gently without damaging sensitive enamel. When used correctly and occasionally, the same diluted solution discussed earlier can help reduce surface stains caused by bacteria. This does not happen overnight. It is slow and gradual. That is important to understand. There should be no expectation of instant change. Consistent, careful use is what matters most. Another common issue after 50 is the appearance of small sores inside the mouth. These sores may show up on the inside of the cheek, under the tongue, or near the lips. They can be very painful, especially when eating or speaking. Healing also takes longer at this age, which can make the discomfort feel endless. These sores are often caused by minor injuries, stress, weak immunity, or bacterial irritation. When left untreated, they can linger for days or even weeks. Gentle care can support healing, but harsh products usually make them worse. For this situation, the diluted solution can be used in a very targeted and careful way. Take a clean cotton tip and dip it lightly into the prepared mixture. Gently dab it directly onto the sore. There is no need to rub. A soft touch is enough. This can be done once or twice a day. You may feel a mild tingling sensation. That is normal. It should not burn or cause pain. If it does, the solution is too strong and should be diluted more. After applying, avoid eating or drinking for a short time to allow the area to settle. With regular, gentle care, many people notice that sores heal faster and feel less painful within a few days. Again, patience is important. Healing takes time, especially as the body ages. One important reminder is moderation. Using any solution too often can irritate the mouth. More use does not mean better results. The mouth needs time to restore its natural balance. Overuse can slow this process instead of helping it. It is also wise to pay attention to overall habits. Staying hydrated, avoiding very sharp or spicy foods, and maintaining regular brushing with a soft toothbrush all support mouth health. Small daily habits create long-term comfort. The key message here is simple. Aging does not mean accepting pain or discomfort. It means choosing care that respects the body's changes. Gentle methods, used correctly, often work better than strong treatments that cause stress to sensitive tissues. In the next part, we will talk about another issue that many people experience after 50, but rarely discuss openly: earwax buildup and hearing discomfort. We will also bring everything together and talk about how small, safe habits can improve daily comfort and confidence. Now let us talk about something many people experience after the age of 50, but often feel uncomfortable discussing: earwax buildup. As we grow older, the body's natural cleaning process slows down. Earwax becomes thicker and harder, and it does not move out of the ear as easily as it once did. This can lead to a feeling of fullness in the ear, mild hearing loss, ringing sounds, or discomfort. Many people try to solve this problem by using cotton sticks. This is a common mistake. Pushing anything deep into the ear can force wax further inside and may damage the eardrum. This risk increases with age as the ear canal becomes more sensitive. A gentle and careful approach works better. When used correctly and in small amounts, the same diluted solution can help soften earwax naturally. This method should never feel painful or forced. Comfort and patience are key. Using a clean dropper, place 2 to 3 small drops into one ear while tilting your head to the side. Stay in this position for a few minutes. You may hear a soft fizzing sound. This is normal. It means the solution is interacting with the wax. There is no need to worry. After a few minutes, straighten your head and gently wipe away any moisture that comes out. Do not insert anything into the ear. The same process can be done on the other side. This should not be done every day. A few times a week is enough for most people. Many people find that taking a warm shower later helps the process. Warm water and steam can support natural movement of softened wax. Over time, the ears may feel clearer and more comfortable without force or irritation. It is important to stop if there is any pain, dizziness, or discomfort. In such cases, professional medical advice should be taken. Gentle care should always feel safe. As we come to the end, it is important to remember that good health after 50 is built on small, thoughtful habits. Strong solutions and aggressive treatments often do more harm than good. The body responds better to patience, consistency, and respect. Taking care of your mouth, throat, and ears is not about chasing perfection. It is about maintaining comfort, confidence, and quality of life. When simple routines are followed correctly, they can support well-being in quiet but powerful ways. Always use care, moderation, and common sense. Listen to your body and never feel embarrassed to take steps toward better health, no matter your age. Growing older does not mean losing control over your comfort. It means choosing wiser, gentler ways to care for yourself every single day.